We are now 2 months after resection of the superior cluneal nerve. And the superior cluneal nerve are nerves that come from the back over the posterior pelvis into the buttock area here, often misdiagnosed for SI joint pain or lower lumbar pain and radiculopathy or nerve root compression. Can you tell us, if you don't mind, what symptoms did you have that led us to consider this diagnosis for you?
I was having pain that was radiating down the back part of my right side of the butt, down through my hamstring, kind of the lower part of the right side of my hip. And it just wouldn't go away. When I was driving, I was having pressure under my leg, and there was just tightness that wouldn't just go away.
Was your tightness more in the upper portion of the buttock or lower down?
More in the lower down portion of it.
Okay. But you, if I recall, you were also having pain with palpation or anything touching the back of your pelvis. Is that correct?
Correct.
And did you have burning back there as well?
I did. It was like a burning, pulling sensation.
Okay. And so we did some nerve blocks on you in the office with ultrasound guidance, and that area of your buttock on the upper part went pretty numb. Is that correct?
Absolutely.
And so we did that more than once just to diagnose that and make sure we thought we had the right idea. So we operated on you. We removed those small nerves. Those nerves go to the skin. So can you tell us a little bit about what happened after that surgery and how you're currently feeling? So what area went numb? How did it feel? How did it transition? And what kind of relief do you think you have now?
So after surgery, I had some, definitely some numbness around the incision and throughout, a couple inches around it. That radiated down into my butt where I couldn't feel it. There's a lot of swelling that went with the surgery itself, a lot of bruising. But the ice and the heat helped out tremendously with some Tylenol. And, throughout the entire period, I noticed that my movement got better over time. The first several weeks were, being careful not to rip the incision open. I did feel some hypersensitivity, like some burning sensations where, just a simple touch to the skin will kind of desensitize that area. And then about 3 weeks after surgery, I really noticed that sensations started to come back to normal. Today, 2 months out, I feel tremendous. There are still some areas of numbness, but that area of numbness has gone down significantly, and I've never felt better.
Fantastic. Do you mind if we take a quick look at your incision?
Sure.
Would you mind standing up so we can take a peek? So the incision this is the posterior pelvis right here. This was a previous procedure he had, and this is the incision here. This is the midline. So it's about 2 inches or so. Okay, thank you so much. And the hypersensitivity is pretty much gone.
Yes.
And that original pain that you had in the back of the buttock is gone at this time.
Non-existent.
Non-existent. Would you consider this successful?
Yes.
All right. Thank you.
Welcome.